Welcome to the segment on activity for a healthy heart. Here, you'll learn the benefits of exercise for your heart, how to get started with an activity plan and keep it going, how to get the most out of your activity, and how to exercise safely. If you have a heart problem, you have the power to make any treatment more effective. How? Regular physical activity. Here's a heart patient. How's exercise helping her? It's building a stronger heart muscle and increasing the oxygen in her blood. It's giving her strength and endurance. It's making her bones stronger. It's lowering her levels of bad cholesterol and can increase her good cholesterol. It's helping to lower her risk of high blood pressure and diabetes, and it's burning calories and building muscle, which can help her achieve and maintain a healthy weight. Almost as important, regular physical activity can improve your quality of life. It releases the feel-good hormone serotonin. Your confidence and self-esteem go up. It can also reduce depression or anxiety. You'll feel better and feel better about yourself.
I just feel more energetic every day. I have more of an appetite, which when I don't work out, it seems like I never eat, but I definitely have more of an appetite. My mental health is better. Just feel better all around.
For many people, the big question is how to get started. Here are 4 basic tips. Start by meeting with your healthcare providers. Get their opinions and help on setting realistic goals. One great way to do this is by joining a cardiac rehab program. See the segment on cardiac rehab for more information. Find someone to exercise with. A partner can make activity more fun and can help you to be more faithful in exercising daily. Also, consider your interests. If you find an activity that reflects who you are and what you like to do, you're more likely to keep it up. Finally, define an exercise program for yourself. Don't just say to yourself, I really ought to exercise. Look at your calendar and schedule specific times and activities.
So my wife and I are over there 3 days a week, on Monday, Wednesday, and Friday, about 8 to 8:30, and we stay between 30 and 40 minutes doing a treadmill, getting warmed up for 5 minutes, and then we do a circuit in the weight room. And the difference is amazing. We're not lifting any heavy weights at all, but we're stretching. We're getting these joints moving where they should. The great side benefit of that is that we have 3 dates each week. No phone, no family, just the 2 of us. And we chat all the way over and then chat all the way home. Terrific.
A variety of types of exercise will keep your workouts interesting and bring more health benefits. Try to fit in 3 types of activity: aerobic exercise, strength training, and stretching. Out of these, aerobic exercise is most important because it gets you breathing deeply and gets your heart pumping.
So I work out I try to get over to the Orthopedic Specialty Hospital is where I work out. And I try to get over there no later than about 20 after 7 every morning, although there are many mornings when I don't feel like it, but I push myself to do it anyway because I made a commitment that I will do that. But I think it's easier if you go to a location, whether that be a health club or like the Orthopedic Specialty Hospital. But even if you buy an exercise machine at home, my understanding and the chances are very good it will sit there and you won't be sitting on it. And everyone else there is doing it. So they are a good incentive. They are a good stimulus for you to get in and do it too. And they start razzing you in a kidding way. Come on, get with it.
What's the right amount of daily exercise? Aim for at least 30 minutes on most days of the week. As you exercise, you want to be at a level of intensity that is moderate to somewhat hard. What does that feel like? You might be breathing a little heavier, but you're not out of breath. Your muscles feel a little fatigued, but they're not burning. You might be perspiring lightly, but you're not dripping with sweat. The simplest way to measure your intensity is to see whether you can talk or sing while you're exercising. If you're too out of breath to carry on a conversation, you need to slow down. But if you can sing a full song without pausing for a few extra breaths, you probably need to pick up the pace. Of course, a cardiac rehab program is a great way to make sure your exercise is appropriate, especially after a heart attack or surgery. Healthcare providers can monitor you and help you get a feel for the right level of intensity. Here are some tips on exercising safely. Warm up at the start of exercise and cool down at the end. In the summer, protect yourself from heat stress, which can put an extra workload on your heart. Try to exercise in the cooler parts of the day and be sure to drink enough water. In the winter, protect yourself from too much cold, which can tighten your lungs and blood vessels and increase your risk of chest pain. Keep your mouth covered, dress in layers, and wear a hat. Pay attention to your body as you exercise and watch for warning signs. Slow down or stop exercise immediately if you feel lightheaded or dizzy, chest pressure or pain, an irregular heartbeat, nausea or vomiting, extreme fatigue or muscle pain, excessive sweating or cold sweat, numbness or tingling in your hands or feet, or shortness of breath that is more than you would expect given your level of exercise.
Thanks to my wife, she got me out and said, let's go out and go for a walk, and let's do a walk. And so I did, and I realized during the course of that walk that, geez, that I can do this, you know, that I'm going to be okay. And she's with me here, and everything happens, she'll take care of me. So after that walk, then I thought, oh, I can do more. And that started an exercise program. It's not about winning, it's about staying alive. It's about just staying in the race, and it's not about winning anymore. So that's kind of how I gauge myself. Staying alive is not a given, that I have to work at it. And if I'm not working at it, then I'm basically giving up. And I'm saying, you know, I don't care about it anymore. And I don't want to do that. I don't want to give up.
This is the end of the segment on activity for a healthy heart. Remember, you're working on building healthy habits for life, so be patient with yourself and keep going.